Hi, I'm Marco Fiorentino from Northgate Public Services, and together with my colleague Imran Mahmood, we're going to examine how technology can help improve service user engagement in a community context. Okay, so what we're going to cover today, we're going to do some introductions and some context setting. We're going to talk about what we mean by engagement, disengagement, and why it matters. We're going to have a discussion around why service users may disengage. We're going to examine what practices may help improve engagement. We're going to talk about the impact of the pandemic and COVID on engagement and opportunities for learning from all the innovation that's happened. We're going to talk about how technology can help. We're going to think about what's already happening in the technology space at the moment, and we're going to think about how some of the challenges that we need to meet can be overcome in order to improve offender engagement. Okay, and to help us bring these topics to life, we've assembled an excellent panel from the sector who will be providing their insights during a series of videos. So we have Joanne, who's a service manager from Rise Mutual, with years of experience working with men who commit domestic abuse. We've got Gordon, who's an experienced practitioner working with adults and children with entrenched behaviours. We've got Namdi, who's a justice consultant and former service user himself. And John, who's our friend from Meganexus, and a former probation officer, is going to discuss some of his experiences. Okay. So a little bit about your speakers. So I'm Marco Fiorentino. My role is Director of Justice and Enforcement at Northgate. For the past 5 years, I've been overseeing development and delivery of software solutions into justice. But we've chosen this topic, it's particularly close to my heart, as I spent over a decade working as a practitioner and manager within accredited programs within the probation service. And I witnessed firsthand how disheartening it is when service users disengage from services that you really believe will help them. I'll hand over to you, Imran.
Thanks, Marco. So my name's Imran Mahmood, and I'm a product manager at Northgate, with 15 years of experience working as a consultant across the criminal justice sector, delivering transformation into a number of different organisations.
Okay, a little bit about us as a company. I won't go through all of these numbers, but Northgate Public Services have been delivering services into the public sector for the last 40 years. In particular, we're here to talk about justice. We have around 7,000 users using our products within the criminal justice setting. We particularly provide software to support delivery of interventions, so interventions manager, media manager, which are being used within the prison and community settings. We work with the YJB. We've helped them deliver the Youth Justice Application Framework over the last 6 years. And we've also worked with a number of private providers of probation services, such as Sodexo and MTC. Right at the bottom there, you see the NEC logo. That's because as of the 1st of July, we're going to be rebranding to NEC Software Solutions. We're part of the NEC family, and it marks a very exciting time for us in terms of opportunities for innovation and being able to help out some of the things that we're going to be talking about in this presentation. Okay, so I'm going to hand over to Imran, who's going to discuss, he's going to introduce us to the idea of service user engagement and what we mean by that.
Thanks, Marco. So what do we mean by service user engagement? So I think it's useful to think about user engagement in two ways. So firstly, formal compliance. So this is where service users are attending their appointments, they're completing what's required of them, they're meeting that minimum behaviour expectation. Secondly, substantive engagement. So what we mean by this is where there's active participation from service users. This is leading to more positive behaviours, they're more engaged with their rehabilitation and assistance from crime. Neither of these things are mutually exclusive, so both can be quite complex and they can operate together. So as an example, formal compliance may sometimes lead on to substantive compliance in some cases as well. So in this seminar, what we want to do is we want to explore how technology solutions can help support both these types of engagement with service users. So here we're going to look at some key statistics that are sort of key indicators for service user engagement. So we can see there is 70% of prison recalls are due to non-compliance. So this means that we know service users are breaking conditions, they're failing to attend supervision, and leading them to be recalled back into prison. 30% of all suspended sentence and community orders are not seen through to the end and are being terminated unsuccessfully. And what we also see is 47% of non-completion rate for those that attend offending behaviour programs. So these programs are expensive to run. They're typically targeted at entrenched behaviours, and what we're seeing there is a very significant dropout rate. And then finally, we see 31% currently reoffend after 12 months of starting their community order. So this would be down to a number of different reasons, but in part down to disengagement as well.
Okay, thanks, Imran. Okay, we're now going to meet our panel for the first time, and they're going to give their views on why some service users find it hard to comply with their orders and or actively engage with the services that they're supposed to be engaging with.
What I heard was not to trust them, or they're not going to give you the right help or support. So from the back of it, you are already not on their side. You're kind of, it's like them versus us. And that alone from the get-go makes it very hard to kind of engage with the person you're dealing with to kind of help get you the right support.
It could be due to complex additional needs, mental health issues, drug and alcohol problems, homelessness is a big one. We've had guys living in cars who we're trying to do intervention with, for example. That happened with a couple of people during COVID. So those are the sort of two primary reasons. It could be learning difficulties, it's kind of dyslexia, dyspraxia, people just not a bit chaotic and not very good at organising themselves. It could be a whole host of reasons, really.
People may be working, people may have multiple children, you have to fit around different times. So if people have to travel to a one-on-one session, it can be, there's lots of obstacles.
Just like everyone else, sometimes you may forget the time or forget who you're going to see. And also that's another point I would like to make, is that sometimes you get a different probation officer, or different worker or key worker. And even that engagement before getting to your appointment, that could help.
People turning up, if they're driving, they've got to deal with traffic, they've got to find somewhere to park. If they're coming on the bus, I mean, there's just so many delays. And so not only is it a timing issue, these are all additional stressors which can make people either anxious or not willing and not open.
But there are still a large number who, unfortunately, probably given the challenges and the difficulties and maybe the infrastructure or the lack of resources, they can't quite deliver the help or the assistance in the way that's tailored to that individual.
Okay, so as we heard from the video, there are a number of different reasons why service users may not engage. Joanne talked about quite chaotic lifestyles, finding it difficult to organise themselves. So organisational skills is a real factor. Communication is also a factor, so ambiguity in the arrangements when the appointment should be. Financial matters can come into play in terms of not being able to afford to get to the appointment. And also substance misuse. As we know, people who are dependent on a substance find it really difficult to obviously find themselves in a way that they can attend a probation office, for example. It wasn't talked about in the video, but from our own experiences, we also know that some service users are really fearful of travelling or attending to an appointment, particularly if it's in a postcode or somewhere they feel particularly threatened. Joanne also mentioned about mental and physical health impacting the ability to engage and attend. And finally, I think probably most tellingly, Namdi talked about motivational factors and kind of almost seeing probation as an us and them type dynamic, and how important it is to be able to buy into what's being done, and how sometimes that can be quite difficult. And also some of the other studies that we've looked at, I've looked at, for example, probation office themselves being quite a hostile environment, somewhere that isn't necessarily conducive to people leading having an identity which is that of a non-offender. Okay, so of course there are many great examples of work that is being done to overcome some of these issues, and our panel are going to discuss some of the work that they're doing, some of the practices that they employ to help improve engagement within the services that they're delivering.
To make them feel heard, because a lot of people go through life and they don't feel that anyone's actually listening to them. So to be a good listener, to hear what they're saying to you, and it's always important to be able to reference something that someone said in the past. That proves that you've heard what they've said and you've remembered. And that can be a key turning point when someone thinks, well, actually this person is at first step. This person is actually listening to what I'm saying. Yeah. So then they can think, well, it's actually worth me saying these things.
They form a relationship with the practitioner, which becomes supportive. Our practitioners will contact them in between sessions as well. We do that routinely, whether it's just like encouraging words or reminders. If we know that they're a bit chaotic, then the practitioners will remind them of the next session and all those kind of things.
So as we heard from the video there are a number of basic things that can be done to help improve engagement. So Joanne talked about some of the practical things, such as just helping somebody remember when their appointments are. And also Gordon talks about some of the strategies that he employs to try and get people through that door. In a recent HMIP inspection, they also picked up on this, and the idea of rethinking the concept of an appointment, the fact that an appointment doesn't have to necessarily be face-to-face or within a probation building. So in that report, they picked up on a particular probation officer who said she used text and telephone to arrange appointments with Alice. She rarely saw Alice in the office, instead meeting with her wherever she was, which included a hospital, a treatment provider, and with supportive family members. This approach resulted in improved attendance and engagement, which was in sharp contrast to Alice's earlier behaviour. And I think that just, again, talks to what Gordon was saying about all of the obstacles that people have to try and get through the door. Family members to look after, financial worries, the stress of having to navigate your way through traffic. So it's really interesting. And also, we know that practical help can be a huge motivator for someone to come in. So again, from the thematic report, it says getting practical help from probation helps. Service users don't often see the work that goes on behind the scenes. And so completing practical tasks together, such as housing applications, arranging and accompanying service users to appointments, can help the relationship. These are some of the things that we want to talk about, how technology can facilitate some of these things. And we can talk about that in the second half of the presentation. And again, very simple stuff, different ways to communicate. One of the studies we looked at recently, Cook and their colleagues looked at a study or a trial of using text messages to remind service users to attend their court appointments. And of course, it dramatically increased the number of appearances that they attended. It sounds very basic, it sounds obvious, but actually this isn't widespread practice. It's just some examples of the easy kind of quick wins that can happen and can improve engagement. And again, we'll see how technology can perhaps help with that a little bit. Okay. Also, so Joanne and Gordon were talking about some of the kind of softer skills and some of the things that they were doing in terms of building that relationship with their service users to help bring them through the door and help them stay there. Imran mentioned about substantive engagement earlier, which is more than just attending. It's actually believing in what you're doing and being there for the long haul and seeing it all the way through to the end. And we know from the research, I picked some studies out here. Many of these you'll be familiar with. There's many more about what underpins desistance research, some of the practices that underpin desistance research, and also some of the proven ways that to make long-term sustained engagement. Some of these things are, for example, co-production and goal setting. So the service user and the worker doing stuff together, and the service user not necessarily feeling done to. Developing a sense of self-efficacy. So service users being enabled to solve problems for themselves and having confidence that they can do that, so they're not reliant. So things like just attending an appointment, for example, is a problem to solve. Service user agency, so the service user having a sense of control over their engagement and over what happens to them during their time they're interacting with these services. Joanne talked about the relationship, building that relationship. Again, all of the research points to the prioritization of that therapeutic relationship. Positive reinforcement, being reminded that you've made progress, being reminded that you've completed stuff, and that you're on your way to creating that non-offending identity. And motivational interviewing techniques, which has long been proven to be a real motivator for people engaging with services. So some of these things, all of these things actually, we're gonna look at these in a bit more detail, and we believe that technology can really facilitate these approaches. Can't replace them, but it can facilitate them and make those things possible to do on a more day-to-day level. Okay. So these issues have been discussed, have been around since day dot, really, in terms of probation and other similar services. We've been through an unprecedented time in the last 18 months through the pandemic. And in fact, COVID has had, as you can imagine, a huge impact on how services are delivered, but also a knock-on effect of how service users engage with these services. And these are both positive and negative, of course. And Imran's going to be taking us through the impact of COVID on engagement.
Thanks, Marco. So as Marco was saying, so COVID has undoubtedly forced a change in the way probation officers have needed to engage with service users. We've seen that with 80 to 90% of appointments first delivered over the phone during that initial lockdown. This has had an impact on both service users and on probation officers. Initially, we've seen service users largely negative, many feeling very isolated without having access to those key services that they needed. However, we've also seen the staff have done incredible things with the inspectorate specifically, and recently, and noting that staff have innovated with new practices very much at short notice to try to improve the way engagement works. So as an example, we saw those telephone meetings happening in the first lockdown, and we've also then seen the use of Zoom calls throughout the second lockdown as well. So it's really important to also note that although the user engagement has improved, there are still some users that are still struggling with compliance during this time as well. So what we're going to now do is get some more feedback from our panel to see how COVID has impacted them.
So followed respects guidance, which was essentially at that time, do no harm. If you do nothing, just do no harm. We had to draw up guidelines for practitioners about how to work safely with service users, all those kind of things, like ensure they've got headphones, ensure they've got a safe space, check if there's anyone else in the room, maybe get them to show you that there's no one else there, stop the session if it materialises that someone's present, all those kind of things.
Whereas if we're doing a Zoom call and it's in their house, there's less childcare issues. A child could be in another room doing homeschooling or doing some homework. Also, if someone's in their home environment, they haven't had to travel, they're relaxed. And if they're relaxed, they're more open, and it's more conducive to learning and more conducive to engaging in the session. So whilst I would have initially always wanted to see someone face to face, I've been really blown away by how effective it's been.
The practitioner's feedback was that some of the men actually responded better, so they had seen them face to face, like one-to-one face to face, and then over Zoom. Some of them actually seemed a lot more open and more comfortable. We should retain Zoom. It's meant that we can work with people abroad. We've worked with several people in different countries, which, even outside London, we used to say no to anyone outside London, which is crazy now. It seems really old-fashioned. So geographically, we are a lot more effective, I suppose.
So to summarise what we've explored so far, so we've had a look at different types of engagement. We've looked at formal compliance and substantive engagement. We've also seen some statistics in terms of what current compliance looks like, and that there is still a way to go to improve that compliance, particularly with orders and licence and engagement with rehabilitation activity. We then explored a range of issues looking at what's affecting disengagement. That's included, and we've heard from the panel as well, in terms of those factors, including practical, financial, health-related issues, anxiety, motivation, and belief. And then we went on to think about what could improve engagement, and these have included a combination of things like practical assistance, and also we've talked about positive probation methods, evidence-based, that can increase engagement. And finally, we looked at COVID-19 and how that's impacted engagement, both in negative and positive ways, but specifically has seen innovative practice that we can build on and harness going forward as well.
Thank you, Imran. Okay, so now we're kind of getting to the second half of our presentation, which is looking at how technology can help. Okay, so service users live in the same world as everyone else. I think sometimes that gets forgotten. And in the UK, the population is now digitally native. with 84% of UK adults in 2020 owning a smartphone, and on average spending 2 hours and 34 minutes online on their smartphones a day, which is an incredible amount of time. This cohort of people will include the service users that attend or that are subject to orders and licenses up and down the country. So they, like us, use these devices every day, and they use them for a lot of the time, as you can see. And they do that to connect with others and with the outside world. They use them for tools, as tools for organisation, to have access to important information, as a way to have a voice, which is really important, as a way to learn and to do business, and as a way to relax and unwind. So they're using these things in their everyday life like the rest of us. As soon as they walk into a probation office, they have to communicate in a different way. They can't use these tools, which again is just a reminder of that kind of offender identity, which they're trying so hard to move away from. Okay, so we're going to look at how technology can help. These tools are already there, so let's think about how we can use them. Okay, so here's just a smart device. It could be any device, a laptop, a smartphone, a tablet. Most of these things have these incredible tools already built in that are already being used by people. So, for example, calendar, GPS, also notifications, reminders, information through the internet, audio and visual content, which can help with different learning styles. So those things here, these are already baked into people's devices. And if they were used in a way that allowed or enabled engagement with services directly through some kind of mutual exchange of information, it can help develop a sense of self-efficacy in the service user, help them feel that they can solve the problem of how to get to the appointment, or where that appointment is, or where my exclusion zone is, for example. A sense of agency. So if they want to access important information about their order, they don't have to request it or phone someone up to give it to them. They can go and access it. So they have that sense of agency. And also, if they're able to use this in a context of their kind of working with their probation officer or their offender manager or whatever it is, it's not reminding them of that offender identity so much, because it's using a tool that they're already using for other things in their life. Also, smartphones are connected. There's a huge connectivity. They have collaboration tools. They have chat, video, and they also have, they're responsive in the way that they work. So again, when we talk back to what Joanne was talking about earlier, Namdi was talking about the importance of that relationship. These tools are there to facilitate that. So, for example, relationship and support can happen not just in between appointments, but not just at the appointments, but also in between times as well. Co-production of things like the plan, instead of being done to and being planned for, it's something that can be done and updated perhaps by the service user in between sessions or in between appointments. And also positive reinforcement. We know that some apps that are out there for other reasons, such as dieting, managing anxiety, managing stress, learning something new, using positive reinforcement, reminding people that they've had an achievement, they've done something, keep going, all that stuff is proven to work, yet it's not something that's being used routinely within this kind of context. We also talked a lot about how difficult it was for people to attend appointments because of having to come somewhere. There are already amazing tools which allow people to do it remotely, as we've seen throughout COVID. So it's really important points that these things, now they're out there, now they're being used more widespread, should be being harnessed rather than being put back into its box when the world opens up again. Okay. So we're now going to go back to our panel, and our panel are going to discuss from their perspective how they think technology can help improve engagement.
From my own experience and having a personal interest in digital, I think what really interests me is the way that we can really use technology to improve engagement and improve kind of that service user buy-in.
So this app needs to be the source of, when you're not with your person or your relevant key worker, this is effectively replace of that. So when you're not with them, you are still kind of with them, but done in a way that helps you and you're not ashamed, because there is a big, again, stigma. People, probation, especially those who may be in difficult environments or situations that want to, not really too proud of where they are, but again, they really want to seek for help. So something as simple as an app can kind of mitigate that thought.
Yeah, I think some of the session materials probably, whether it's power and control wheel or sort of skills stuff that we've covered, would be really useful. It's the skills that they tend to remember best that we cover. So anything like that that keeps people going in between sessions, I would say would be most useful probably.
Also being able to digitally track their own appointments, for example, I think that might be really important. You know, I came from a world where you'd hand out a card with their next appointment on and you'd see it in the car park on your way home, you know, and I think maybe having some way of them keeping themselves engaged and knowing when their next appointments are. We're trying to get into a position where, particularly with APT, a service user doesn't feel like they're being planned for, or here's your plan, go and do it. We want that full engagement and full buy-in.
Just like you and I, we all probably absorb information differently. Some people like to read, some people like to listen to music or audio, or some people like to more visual, they like to watch things. And it's the same thing with support, with assistance, the exact same way. So something like an app, something that I've always been a massive advocate of and I'll always push forward, would be a really, really huge step in the right direction.
Okay, so there were some great insights there from our panel about how technology can be used. Really interested in terms of what Namdi was saying there about, he was saying that, if he'd had these tools almost before, it would have helped him feel connected with his officer during the time that he wasn't with them. He said, I'll be with them, but not with them. And I think that's such an important point, because for a lot of people, particularly when they come out on license, they can feel very isolated, and that appointment, once a month isn't enough. So it's another way of just staying connected. And, the stuff that John was saying there, really interesting about, and I've seen this happen myself, where an appointment is given and then it just ends up in a car park when you're walking home. Frustrating, but, this isn't necessarily how people are used to remembering appointments, being given a card, particularly in 2021. So whatever we can do to help is hugely important. Okay, so there are some, although we're at the beginning of this journey for, technology in the sector, there's already some amazing work being done by other organisations, not just by Northgate, but other ones. We want to give a shout out to that. So, for example, the Probation Board at Northern Ireland developed their own app called Changing Lives, which is award-winning. They've done an amazing job doing that. It's designed to help service users get organised, stay in touch with their officer, and access key information. We heard from John from Mega Nexus, who are doing some amazing work in prisons and have done for a while, through Virtual Campus, or APT, as I think it's now called, which is a service user facing assessment and planning and tracking tool, which is being used to give service users, agency and involvement in the rehabilitation process and access to a whole host of really useful resources. So that's some really good work they've done. And also in the prisons with HMPPS, the TimeWise tool, great work, which is service user designed and curated content, which is there to help make intervention work more powerful, more relevant, more accessible, designed by service users, not just designed from the centre. So brilliant work. And we shouldn't forget the major players, who are, they don't need any kind of introduction really, but the likes of Zoom and Teams and Google for Education. What they've done and what they've been able to do in the pandemic for everybody else is to create a platform of trust in technology, and actually to give people a sense that these things, you can use them safely, you can use them for good, and it's given a platform and a challenge to all of us to do something with that and leverage that. Okay, so I am going to hand over to Imran, who's going to talk a little bit about what we've been doing at Northgate with our own application, MyPathways.
Thanks, Marco. So our solution is called MyPathways. This is part of our wider Pathways solution, which includes our Youth Justice Pathways product. We've got a number of features that we've developed into the application to support some of those good evidence-based practices that Marco's talked about, we've heard from the panel. So we've included in there the ability to manage appointments or supervision appointments, the ability to set reminders and receive notifications about them. So you'll see on that screenshot there that there's a countdown to the next appointment, which hopefully will remind service users when their next appointment is going to be. They can access key information about their sentence and order. They'll include things like their curfew and exclusion zones that can be visually seen on the application. They can explore useful resources. They can be signposted to other critical services and agencies. They've got the ability to journal their thoughts and feelings, and that can be shared on a daily basis to their probation officer, and also the ability to track their alcohol and drug use, and this could be part of their plan, and also could be shared with their probation officer as well. So all those things are sort of supporting them to give them that sense of agency, improve self-efficacy, and engender that trust and identity. On the app as well, we've got the ability for them to access their case plans. It's really important for them to be jointly working on their case plan with their officer, to update their objectives and goals together. They've got the ability to use secure video conferencing to be able to do that inbuilt within the application with their officer. They've also got instant chat messaging, the ability to keep in touch on a regular basis outside those supervision meetings, and also share resources, set work, upload evidence against their plan, and engendering that mutual feedback. So again, we're looking at those positive probation, positive reinforcement, relationship and support, and co-production as well. So again, this is all part of our Pathways platform. It's called our MyPathways solution for youth justice. So we encourage you to come to our virtual stand to arrange a demonstration of the application, and we're really interested to hear your feedback on the application as well. So we've talked about some solutions, but as a sector, there are a number of challenges and that these solutions also present, that we want to work together to try and solve. So this is a selection of some of those challenges. So firstly, we've got the access to the devices and data plans. So as justice and technology organisations, we want to be able to come together and offer a managed service solution where we should include the software, could include the devices, data plans and support, an end-to-end service to make sure it works for justice organisations. We also need to make sure everything is secure. So this is using technology to keep the application and devices secure, managing the integrity and protection of the data that comes with this as well. Really key to ensure that we integrate with case management systems. So this is existing systems and new systems, using the right technology to be able to integrate with them seamlessly and have that mobile application being able to interact with case officers in the office. Need for online features, so where we don't have data available or Wi-Fi is not available, the app still needs to be functional, and then be able to upload relevant information once it comes online again. And accessibility needs to be key. So we want to design for accessibility and usability for all types of groups as a priority from the very start of designing the application. And then we've got cultural change as well. So this will be required. We need to get staff buy-in and build on those COVID practices that we also mentioned in terms of innovative practices and being able to engage in a different way using the app. And finally, a challenge around sort of the app itself could feel intrusive to some service users. So it's important to note that these will be opt-in tools, so not made for everybody, and they won't be mandated. And whilst they've got those benefits, we need to make sure that we get more service user feedback and improve those features and really increase the uptake for those that can really make a good difference. So we've tried to address a lot of these challenges within our MyPathways solution, and we welcome feedback on those and any other challenges that may need to be addressed.
Okay, thank you, Imran. Okay, so we're at the end of the presentation, really. We just wanted to do a recap about what we've covered. So we know that engagement with justice services is still an issue. So from some of the stats that Imran presented earlier, we know from the videos that we've looked at and also from some of the studies, there are many good reasons why service users may not engage, from the practical to the motivational. We know that good practice points to a combination of practical help and strengths-based approaches that we've talked about throughout. So some of that desistance theory kind of coming to life. We know that COVID has shown services how they can adapt and innovate. There's almost a sledgehammer that went through public services during the pandemic, and public servants have had to learn how to innovate at last minute, where they may never have had to do this type of thing before, use some of these technologies. They've done an amazing job, and those things should be some of those things should continue even when the world opens up. The second half of our presentation focused on how technology can play a role in providing practical support and engendering practices consistent with positive probation approaches. So, we looked at how, staying connected to somebody, having tools to make you feel like you're able to solve your problems, they can really help. We heard from Namdi on that. He was really quite passionate about if he'd had these tools himself. There is some good work that's happening. So colleagues in Meganexus, colleagues in HMPPS, the Probation Board of Northern Ireland, stuff that we're doing at Northgate, and there'll be loads of others. We're kind of at the beginning of the journey, and there's a lot of challenges to overcome if we're going to be successful. But there's some great minds out there, some great companies, some great practice, some great ideas and opinions about this. That I think if everyone came together and worked together on this, if people were really passionate about it, things. Some of the examples we've seen at the moment, hopefully there'll be hundreds more of them. And we certainly believe with our at MyPathways, we've tried to do that. But again, we're really excited to see what happens next. Thanks for joining us today. Visit our e-stand at the Modernising Criminal Justice Conference. Find out more about us at northgateps.com. Drop us a note and pick up the phone. And hopefully we'll see some of you at our stand, and to develop a further conversation about this. Thanks very much.